Proper port placement and joint clearance is essential for optimizing robotic arm movement and minimizing collisions. To understand best placement for the assistant port, we must first discuss what surgeons consider during their port placements. Start by placing the camera port approximately 10 to 20 centimeters from the target anatomy. All other robotic ports should be spaced 6 to 8 centimeters apart, roughly one hand width, in a straight line if possible. The same spacing should be taken into account when placing an assistant port. Ideal placement is approximately 6 to 8 centimeters triangulated underneath the other robotic port sites. Keep in mind that laparoscopic instruments are much shorter than robotic ones. If multi-quadrant surgery is anticipated, triangulate the assistant port closer to the quadrant where the majority of the assisting will occur. If unsure, a good compromise is to place the assistant port 6 to 8 centimeters directly behind the camera port so there is flexibility to assist in either direction. If instrument length is still an issue, consider opening longer bariatric laparoscopic instruments to obtain the necessary reach. After port placement and docking, it is important to check for proper patient clearance and flex joint positioning. Once targeting is complete, use the port clutch button to adjust all the flex joints. For the Da Vinci Xi system, try to keep all flex joints aligned on approximately the same letter. For example, set all joints to letter L or set all joints to letter E. This maintains even spacing and minimizes risk of arm collisions. It also allows for lateral arm adjustments later in the case if necessary. Lastly, maintain at least a hand width of spacing between all joints to ensure smooth and collision-free arm function. If flex joints are in the proper position, but more spacing is needed, you can adjust the robotic elbow joints using the patient clearance buttons located on the back of the robotic arm. Mastering port placement and flex joint positioning lays the foundation for an efficient and successful robotic surgery. Small adjustments up front can prevent big problems later on.